Hi everyone, I'm Dr. Anuradha Medoju. I'm a Senior Region Director and as well as Chief of Airport Health Organization and for both Andhra Pradesh and Telangana from Ministry of Health and Family Welfare, Government of India. And we are taking care of from the sub-center to the primary health care and the secondary and the tertiary care and as well as Prime Minister Relief Fund and we will take several projects from all over the country to establish the medical colleges and so strengthen the medical colleges at the primary level and as you know, health and wellness centers and medical college strengthening and maternal and child health blocks and super specialty blocks and whatnot. And not only that, the budget and then which we are releasing to the states and all these things, and then we will take care of. And as you know, as a Chief of Airport Health Organization, and then Hyderabad, Vijayawada, Tirupati, and Visakhapatnam are under me. And as you know, we were discussing about the COVID, and then that time, and then international health, that weightage, and then how much of the importance of the international health. We could able to do it successfully in the COVID, and then how we tackled the India. That's really, it's a marvelous thing. And not only the community and the public sector and the government sector and as well as the private sector, all of us together, and then we can win the COVID. So in that, just I would like to say, and then when the first wave has come and in Singapore and the China has been started, so that time within 24 to 48 hours in all the airports, the screening has been started. And then we have done the diagnostics to those people, RT-PCR was done. And there is a lot of awareness and then has come down. That's the way the government of India is working.
Well, that's great to know that the government of India is really pushing forward to bring more innovations and more initiatives to the healthcare sector all over the country. Perhaps could you highlight a few specific examples of what is being done to really drive innovation from the government's perspective?
You mean to say in the digital transformation?
Digital transformation, but overall in the healthcare sector?
Yeah, we have, you know very well, and then our independence is 75 years of independence. But in the health sector, and then now the sir was saying about the GDP 1.1, but now it is increased to 2.5. And then by the 2025, we want to bring up the GDP to 2.5. Now it is 2.2 last year, and then this 2.3 GDP percentage, and then we have allotted to the health sector. And then the government of India is very much keen, and then you know very well our the Prime Minister, Mr. Narendra Modi Garu, he is very much particular about Sabka Saath, Sabka Vikas Hona Chahiye. So how we should be happy at last, and every person, even the poor people, the rural and the hilly areas and the tribal areas, everyone should get a health care. And then we should not see any type of communicable or non-communicable or maternal or the child neonatal deaths to be reduced. So this is a systematically we have planned for everything since last 7 years, and then you must be watching and then how the healthcare system has developed, even including the medical colleges and the medical postgraduate medical seats, and every district hospital we are converting into the medical colleges, so that it brings the doctor patient the percentage also it improves, and the postgraduate seats have been increased, super specialty has been increased, and the many of the AIMS institutions have come all over the India, and along with the district hospital medical colleges. So our aim, and then you know very well 7 years back, and then how many medical colleges are there now, how many medical colleges were increased. This in the medical college, if you ask me, in the DME, on the medical education part. But as you know, the tertiary care already I touched upon, and then how we are building up of infrastructure. And as well as in the sub-centers and the primary health center, it's not only we are talking about the clinical management and the treatment and the diagnosis part. We should concentrate on the prevention part too. So how the awareness can be created, how the prevention of the methods, how we can do it to the community, and then how the wellness is nothing like as I told in the morning, Health is this is not a part of Ministry of Health and Family Welfare. Along with that, the other ministries also have equal responsibilities like sanitation and water sources and roads, and all this have a integrated development. So that's what we are looking into. That the roads have been developed a lot now,
Yeah.
and the infrastructure, now we are concentrating the infrastructure. The before that, the 7 years, and how other government structures now, the how fastly how we have done in the infrastructure and human resources training part, and then everywhere we are making the India to become a number one in the health sector. And then for that, I would like to add upon, and then our country, and then we would like to see as a medical tourism. And then for that, you must be knowing 156 countries already e-visa, e-medical visa, and then we are going to issue. So this is the way we are encouraging the tourism, also medical tourism.
Well, it's very inspiring to know the various initiatives that the government has taken to make India, our country, a world-class healthcare facility and a world-class healthcare provider, such as, in developing the surrounding infrastructure, developing the surrounding hospitals, increasing the number of graduate seats, also in making the visa norms a lot easier. All of this, amongst many other steps that you have taken, is very inspiring and very heartening to see these things, Dr. Anuradha. That's very, very good. Shifting gears now to the summit that we are a part of today. Can I ask, what brings you to the summit? How did you learn about the Healthcare 360 Summit? And what has your experience of the event been so far?
This is not the first time, and then I'm there in the health summit. So before also, from 2016 onwards, always health summits, I'll be there. I'm there, and then I'm attending, and then whatever this every district hospital should become as a medical college. There's so many thoughts, and then I was sharing on the dais, and at the same time, and then this really, it's my privilege and it's my pleasure to participate in our 7th edition of Healthcare 360 Summit. And I would like to thank all the organizers and sponsors too. It was a beautiful, and then the one thing what I would like to say, always mainly the doctors, they have a platform like attending the technical sections like a CMEs and all. They will update their knowledge, but as Dr. Subramaniam said, and then the leadership qualities has to be increased when the doctors are going into the businesses and the hospital sectors, like in the private hospitals, what we are learning now. And then doctors should know, like a hospital designing we were talking about, and then how is the feasibility between the architecture, means the civil engineers and architects and electrical engineers, biomedical engineers, and the doctors should know how to what, and then protection of our patients, like a fire safety and the climatic changes, and all these things has to be participated. So this is one platform, and then which I've seen a number of different the participants and different delegates have delivered different lectures, and really it's an informative, and then which it's useful for the all the upcoming hospital people, and as well as already settled, because it's a just exchange of ideas, and then always the innovations they come from us only when we चिंतन वो चिंतन शेयर चिंतन हम लोग सब कुछ करें तो बिल्कुल कुछ ना कुछ निकलेगा. So this is one platform, and then it's good platform, and then I wish you all the best and for future editions, and then I would like to congratulate all the team members.
Thank you so much. One quick word about the exchange of ideas that you just pointed out, Doctor. A word about your fellow participants, the kind of delegates and audience that you were able to exchange ideas with. What do you think about your colleagues that you have met here today, and the kind of networking opportunities that you see over here at the summit?
Absolutely, because now I hope the Digital India of our Prime Minister's vision in 2015, it has to go to the every clinic and every small hospitals also. But as we are discussing the total day, about the ABA identity cards, and then about the security, about the digital, how to maintain the storing, health record storage, and all these things we are talking about. And then now the tertiary care hospitals, they were doing very well, and the big hospitals also, they were doing very well. But I think, and today I have discussed about the digital mission, and then how the incentives can be paid to the software stakeholders who are developers, I can say. And then what is the percentage, how they can get the incentives, how can they motivate the other organizations. I feel in this situation, and then we have to go a little bit down. Like even the small clinics are there, small clinics, and 5-bedded, 10-bedded nursing homes are there. And then we have to encourage, mainly because whatever the act, it's not that how much the incentives the hospital is getting, or as the software developer is getting. That's not the issue. But the record, whatever we are maintaining in the record system, if that patient goes to anywhere in the country or out of the country, they could able to track the history of the patient, and then we can save the life, and then what the medicines he is using, and then how, when he has stopped, and then who is the consulting doctor. So these are the information, and then when we go to the history, we can take it out. This will help the life in emergency and all these things.
Yeah.
Even the changing of medicine, changing of doctors. So there's so many issues are there. So we can take by doing the data analysis, and then we can take more steps in this field.
Well, thank you very much for sharing your experience with us, Dr. Anuradha. And thank you very much also for your kind words about the summit. We really appreciate it, and we're happy to know that you've been with us for the last 7 odd years and 7 previous editions as well. And of course, we look forward to hosting you at the next edition as well. Thank you very much.
Thank you so much. Thank you.
Thank you.